So diphenhydramine is brand name Benadryl, and this is a first generation antihistamine. What first generation means is that something in the second generation has happened to distinguish it from the first. In the book, it talks about antipsychotics, and the first generation has significant extrapyramidal symptoms and somnolence associated with some of the drugs, where the second generation antipsychotics don't really cause that extrapyramidal symptoms in the same degree as that first generation, but they have very specific metabolic effects, diabetes, hypercholesterolemia, things like that. The point I want to make is that this is a first generation. It was one of the first ones that came along. It doesn't mean it's worse. We use it all the time. But because of this side effect of drowsiness, we want to recognize that we shouldn't be driving with it or something like that. But it's also used in a positive way in the PM and Tylenol PM, which we'll get to a little bit later. It's an H1 receptor antagonist, and I mentioned the H2 receptor antagonists in the GI section: ranitidine, famotidine, and you really want to be careful with the stems. So diphenhydramine doesn't actually have a stem, but on many of the YouTube videos, many of the those guys that kind of create these videos and get you to their website or whatever it is, they talk about ene as being a stem and that you can recognize antihistamines from it. But if you think about it, that's just a heuristic cognitive bias. A heuristic is a shortcut, and a cognitive bias means that because you've only seen maybe diphenhydramine and loratadine, you think, oh, everything I've seen that ends in ene has always been an antihistamine, so it must be so. But just think about morphine. Well, that ends with ene or ine. And there's many, many drugs. 20% of all drugs actually end with ene. So there is no stem with diphenhydramine. And I'll show you the stem that goes along with loratadine or Claritin. But you really want to be careful with those stems. Make sure that they're coming from a credible source. Here in the States, it's the United States Adopted Names Council. They've got theirs on the American Medical Association website. If you're in the UK, for example, there's the British Approved Names, and then there's the World Health Organization that has their stem book, and those stems are there as well. But we want to be careful with that. As far as the brand name and remembering it, well, first, the word bed is in there if you take the NA out. So you can think of Benadryl as something that can help you get to bed. But also, there's the beginning of ben, so something like benefit, and then dry, because antihistamines tend to dry up the secretions from allergies and things like that. So Benadryl starts us off with the first generation antihistamine. Then we're going to go to a couple of second generation antihistamines that aren't supposed to cause this sedation. The first one I put in here, and again I'm sticking with this, if you're in a category or subcategory, I'm going to alphabetize it. So cetirizine comes first, and loratadine will be next for Claritin. So cetirizine is brand name Zyrtec. This is a second generation antihistamine. It is an H1 receptor antagonist. Now be careful, some students get that confused, maybe under the pressure of the exam. Benadryl or diphenhydramine is first generation H1 receptor antagonist. Cetirizine, loratadine, these are second generation antihistamine, but still an H1. So that 1 and 2, sometimes students get the generation versus the receptor mixed up a little bit. The cetirizine, it's spelled T-I-R, but you pronounce it T-E-A-R. So cetirizine, you can think of the tearing from allergy eyes as a way to remember this one. Loratadine, this one does have a stem. It's A-T-A-D-I-N-E, and it's brand name Claritin. The commercials, Claritin Clear, tend to help students really remember what this one's for, clearing up allergies. But I want to talk about this stem a little bit. So tadine and tadine are pronounced the same. So famotidine and ranitidine, those are both H2 blockers for GI. The TADINE or ATADINE in loratadine has a very similar sound, and those can be mixed up when talking. So it's very important to be very clear, and there's this push towards, well, just talk in generic names. But just talking in generic names, to me, is like just talking in first names. But if you talk in first and last names, then you clear something up. Oh, I wanted to talk to Bob. Bob. Well, Bob Smith. Oh, okay. So that gives you a little bit more information. So I know that some of the exams are going towards all generic, but patients talk in brand names. Brand names help you remember what the generic is for, and sometimes the easiest way to get to remembering the generic name is through the brand name. As I mentioned, Claritin, Zyrtec, is a second generation antihistamine. It doesn't cause the drowsiness that we see in diphenhydramine. It's an H1 receptor antagonist, so again, it's for allergies rather than gastric reduction or gastric acid reduction. And again, just remember that it's second generation H1. Try not to get it confused. The antagonist H1 versus generation. And then I mentioned the atidine stem and then the Claritin clear. So one confusion patients tend to have is loratadine versus pseudoephedrine. When you have a runny nose, that's something that you would want an antihistamine for. If you have a stuffy nose, that's something that you want a decongestant. That is, it decongests, remove the congestion from your nose. Loratadine is the second generation antihistamine I just talked about. The pseudoephedrine is the D for decongestant. Now, that's just generic for Sudafed, which I'll get to in the next slide. So we've combined a second generation antihistamine, an H1 receptor antagonist, with a sympathomimetic. Well, what does that word mean? Well, the sympathetic nervous system is one that's the fight or flight system. And the mime, M-I-M-E, is to mimic or to do the same thing as. So a sympathomimetic does the same thing as the sympathetic nervous system. And in this case, it's going to decongest because it's just how it works. The stems, we have atidine for loratadine as the second generation antihistamine. And then DRINE, D-R-I-N-E, is actually a stem for the pseudoephedrine, the sympathomimetic. The way to remember, so again, Claritin clear, that tends to help people remember, okay, clear up my allergies. And then one of my students said, I'm just fed up with nasal congestion. The PHED in pseudoephedrine is how they remembered the D in Claritin D, and I thought that was pretty good. Pseudoephedrine and Sudafed. So this is a sympathomimetic, as I said, so it just mimics the sympathetic nervous system. But that's why you get this jitteriness with it, is that it does cause that increase in heart rate and things like that. So be careful with patients that have uncontrolled hypertension. Decongestant, okay, so that's what it's for. The stem is DRINE, and I mentioned the fed up with congestion. Now the difference between this Claritin D and Sudafed and then just something like Claritin is that you can't find this over the counter, but you'll have to find it behind the counter. This might be a little strange to someone that is used to seeing things over the counter, and this used to be that way. But what we've done is, because this is a medication that you can make into methamphetamine, an illegal drug, it's controlled now, so you have to show some kind of driver's license or something like that, and then you're limited to the amount that you can get. Phenylephrine or neosynephrine, this is the nasal one. It also comes in combination with other medications, and you'll see it abbreviated PE. So if something has hyphen D, it means it's the decongestant pseudoephedrine. If something has hyphen PE, it's the phenylephrine. And then we went over we'll go over the DM for dextromethorphan, and then that's the antitussive or anti-cough. And then the PM, which is diphenhydramine, which is to help someone sleep. So, like pseudoephedrine, phenylephrine is also a decongestant, but this is a nasal decongestant, so it's a spray, but it can also be found in some liquid cold products. It has the F and the RIN, so you can see that there's no official stem here, but you can see that there's certainly some similarities in the words. And neo just means new, so you can just think of it as some new decongestant. We'll go from the phenylephrine to oxymetazoline. Now, oxymetazoline or Afrin is a decongestant that, strangely enough, the brand name sounds, I think, a little more like pseudoephedrine, but the generic name in no way tells me, what it's for. But oxymetazoline is Afrin. It can cause rebound congestion, which means that if you use it too many days in a row, and I think the limit is 3, then you actually have to, there's a couple different ways to treat it, but the idea is this is just a very, very short-term solution to some nasal congestion. You'd be able to use Sudafed on a more chronic basis. So we've just seen 2 medications that can be used intranasally, the oxymetazoline, the Afrin, and now we get to triamcinolone, brand name Nasacort Allergy 24-hour. This isn't for an acute or for acute congestion. This is a medication used prophylactically. That is, we want to prevent these allergy symptoms. So the brand name reads like exactly what it is. It's Nasa for the nose, Cort, it's a glucocorticoid, which means it's a type of steroid for inflammation. Allergy, it's for allergy, and 24 hours, that's how long it lasts. So a lot of students tend to use this alone as a stem. It's not really a stem. Prednisolone is another medication that can be taken that's a steroid, and anytime you see similarities at the end, you just want to be careful that you're using something that's an established stem. So I'd be a little bit careful with that one. In prednisolone, the P-R-E-D, that's the actual stem. And then how do you remember it? Well, I think the brand name makes it quite easy. The nasal plus glucocorticoid, the Nasacort. So it's a glucocorticoid for nasal allergies. Guaifenesin with dextromethorphan, Robitussin DM. So this is a combination product, and some students get mucolytic confused with antitussive. So a mucolytic is something that breaks up mucus. So guaifenesin you'll find as Robitussin plain, or you'll find it as Mucinex. You might recognize it from the, I don't know what his name is, but there's this green kind of blob-looking thing that's I think it's Mr. Mucus or something like that. And that's guaifenesin. That breaks up the mucus. The dextromethorphan is meant to stop the cough. So if you break up the mucus and stop the cough, the idea is that we can relieve the patient's symptoms. This Orphan stem, I won't get into it too much because it is technically a derivative of morphine, but it's over the counter. It's so far removed from morphine, there's no addictive potential and things like that. As far as scheduling with the Drug Enforcement Agency, though dextromethorphan by itself has been abused. And then to remember it from Robitussin, well, Robitussin robs your cough is one way that a student said that they remembered it. Bacitracin, neomycin, polymyxin B. If I said those three names, you might not recognize it, but if I said Neosporin, that might be more familiar, and Neosporin's the brand name. So this brings in a couple of good points. If you have certain antibiotics, and they might have serious side effects if you use them parenterally, let's say IV or something like that. But if you use them topically, they can be very safe to the patient. Bacitracin, neomycin, polymyxin, if you put it as, take pieces of each word, that's how you get the word Neosporin. So neo from neomycin, the sulfate part of neomycin sulfate takes the S, the PO from polymyxin, and then the R, the I, and the N from bacitracin. I want to talk about that mycin stem, though. Mycin just means that it came from Streptomyces bacteria, is how this antibiotic was formed. So mycin doesn't really mean anything. It doesn't put it into a class of drugs. There's erythromycin, that's a macrolide. There's gentamicin, that's an aminoglycoside. Neomycin is also an aminoglycoside. Mycin, it might mean that it's an antibiotic, but I really would caution as using that as a stem to remember that it's in a particular class. Maybe it's a hint, but I don't think I would use it that way. Butenofine, so that was an antibacterial, Neosporin. Butenofine is an antifungal, Lotrimin ultra. And there's another drug, terbinafine, which is also, you can also get this over the counter as a cream and then by prescription as a tablet. So I didn't find a nafine stem when I looked at the resource, but it seems they're pretty similar. And then to understand that Lotrimin ultra might not have the exact same thing as Lotrimin. If it weren't for all the showiness and the colors and all of that stuff, patients would really benefit from all of the OTC drugs being turned around. That way you know exactly what the active ingredient is in it and why I put them up here. Butenofine is an antifungal. So we start with an antibacterial, then to an antifungal, and the next one I want to go over is an antiviral. So Decongestant is an acute antiviral. That is, if you have some kind of cold sore, you can apply this. And I thought, who would ever spend $20 or $25 on this little tube for a virus? And then I thought, well, if I was going to homecoming and it's the only time I ever get to go to this dance or something like that, then I'd probably pay the money for it. So I always thought of Decongestant and going to the ball. So maybe that'll help you remember it. And then the name Abreva, to abbreviate the cold sore, how long the cold sore is going to be around, that's what it does. So hopefully those mnemonics help you a little bit. So while this one wasn't for acute infection, let's talk about influenza virus vaccine, Fluzone. This is a prophylactic vaccine, so we're giving this medication hoping to not get the virus in the first place. It's over the counter, sort of. Pharmacist in Iowa certainly can inject this and provide this kind of vaccination, but you can't just find it on the over-the-counter shelf. So maybe without a prescription would be a better description than OTC, because it's literally not over the counter. It's behind the counter, and you have to go through some paperwork to get it. But you don't need a prescription, and then depending on the child's age, you might not need a prescription. What I do want to talk about is this brand name and this confusion that some students have between flu. And this is why you kind of have to remember, you have to know all the brand names, all the generic names, and I think that's very possible. So the book really goes over, hey, you can learn these 400 words, 200 brand, 200 generic, and here's a perfect example of why it's so important to be that literate in the drug names for your patients. If you have Tamiflu or Fluzone, then likely it's for influenza. Okay? But if you have flu, FLU, in a generic name, then it probably means that it's got a fluorine atom in it. It has nothing to do with the flu. So we're talking about something like fluoxetine, which is a selective serotonin reuptake inhibitor antidepressant, and that flu it's just a fluorine atom that just happens to be in the molecule. There's flucytosine, there's fluconazole, which is an antifungal. So you really have to know not only the brand and generic, but which is which. And then this is a great example of where flu comes in and can be a little bit deceiving.